So as the basic scientist, I provided the scientific rationale behind this trial. And the idea came about 7 years ago when we had interest in Fulvestrant, which is already used in the treatment of breast cancer. And Fulvestrant has been known for some time to lead to the degradation of the estrogen receptor in the nucleus. And this is well established. But there's another function that or effect of Fulvestrant, and it's in promoting the aggregation of the estrogen receptor, of the newly synthesized estrogen receptor in the cytoplasm. So this was known before, but it was never actually exploited therapeutically. And so we know that protein aggregates can cause cell death. And in neurodegenerative disease, for instance, this is very well established. So we were in a situation, therefore, where you have a drug that can actually induce the aggregation of a specific protein, which is the estrogen receptor, which drives breast cancer growth, most breast cancer growth. And so we decided that maybe we could take advantage of those aggregates. And the aggregates are usually normally eliminated from the cell through the proteasome. So there's a proteasome inhibitor that has been developed for other type of cancer, multiple myeloma. And so we decided to combine Fulvestrant with Bortezomib, which is a proteasome inhibitor, to see if we can increase the accumulation of those estrogen receptor aggregates in the cytoplasm and increase toxicity or efficacy of the drug. And indeed, we found that combining the two drugs was able to increase the aggregate, and that led to the activation of a stress response called the unfolded protein response, and that increased the efficiency of the drug both in vivo and in vitro and in vivo in mouse model of xenograft, where we had a model of tamoxifen resistance, where we saw that the Fulvestrant alone had some effect, Bortezomib alone had some effect, but when we combined the two drugs together, we actually had a regression of the tumor. And so that essentially is the core of the scientific rationale that led to the design of the trial.